Hello everybody, this is Namita Thapar, Executive Director of MCure Pharmaceuticals, and today's topic on Uncondition Yourself is a very important one and one that we don't speak much about. Alzheimer's, dementia, Parkinson's. What does this mean exactly? Why is there such a large diagnosis gap? And most importantly, I couldn't even research and find numbers that matched. Today, joining me, we have our expert, Dr. Harish Shetty.
Hello.
We have a wonderful caretaker. Thank you so much for joining us today.
Thank you so much.
For a very basic understanding of what is the difference between these three terms, dementia, Alzheimer's, and Parkinson's.
Dementia is a very broad term. It's an umbrella for many different types of dementia. Alzheimer's is one type of dementia, but Alzheimer's is now used also as a term for everything around. What is very important in these two illnesses is that I still remember this woman coming and saying that my mother remembers everything 20 years ago. When I told her this is a memory problem, this is dementia, which is actually an issue with the memory. And she said, she remembers everything 20 years ago, but she does not remember where she kept her purse, where she kept her keys, or what conversation she had. And that's when I told her, what you learn first, you lose last.
Oh my God.
What you learn last, you lose first. And that is Alzheimer's, or that is dementia. Now, dementias, many types. Some of them are very slow, some of them can go down very fast, and the speed of deterioration, that's the brain cells dying, can be very different in different patients. Parkinsonism is an illness where the basal ganglia of the brain is affected, which means you can have tremors, you can have slow movements, and you can have rigid arms and legs. So it's a very discrete form of an illness. So these are the basic three terms. But I would tell everybody who's listening to the show, if you have issues that you've forgotten your purse, you don't know what he said, and you cannot remember where you have kept your things, and you are approximately 45 to 60, please go and check.
Did you just say 45?
45 to 60. Though
I mean,
dementia is
I think there's this thought or common misconception that this only happens to old people.
Generally, dementias are late, but certain dementias can start very early. And
As early as 45?
I've had a patient 2 days ago who has 2 businesses, but suddenly he had a loss of cells, and his MRI showed atrophy or the death of a lot of many cells in the brain, and he just cannot remember. He just cannot think what he should do. His abstract thinking is lost. He cannot conduct his business. Sometimes it can start much earlier.
But tell me something, when you think about this happening post 60, you can justify it as wear and tear of the human brain and body. But it happening as early as 45, what could be the cause of it? Is it genetic or hereditary?
It could be, the causes could be really many. Genetic is one of the most important causes. But I would warn everybody who's listening to the show, if you smoke excessively, you'll get it.
Oh, really?
And if you drink a lot, you'll get it. I would give a message to all the young and the old who believe that alcohol is a stress buster. And you have a lot of alcohol, you smoke a lot of cigarettes, you might take drugs and other substances, that may cause dementia. Also, uncontrolled hypertension, uncontrolled blood sugar also can cause a lot of dementia. If you have disease of different other organs, that can affect the brain and that can cause dementia. And recently, Namita, it's very shocking. People who sleep less for a long time, insomnia and sleep deprivation, they're two different things. Insomnia, I sleep less. Sleep deprivation would mean I watch OTT. Playing around with your sleep, there is some evidence to say that it can cause dementia. मैं तो सभी को कहता हूँ, अपने भेजे से पंगा मत लेना, पलटवार करेगा. So these are the commonest causes for dementia, but we really do not know the genetic aspect. In dementia also, a lot of proteins get deposited inside the brain, and ultimately memory, thinking and behavior is affected.
Supposing I have one of these symptoms and I come to you, of course there will be history taking that every doctor does, but are there any tests or any devices that would be used for a more firm diagnosis of these two conditions?
Absolutely. First, most important thing for any doctor is history. And the second would be neuropsychological testing, imaging of the brain, and many other tests which a doctor would actually advise. And he or she would also do a systemic analysis of all the organs, the gastrointestinal organ, the lungs, the heart, and the brain, and they would rule out any metabolic reasons for those changes. And also sometimes early cancer can come as dementia, because you might have metastasis in the brain which are missed, and and if you do not do all that, you'll miss the dementia. Sometimes a space occupying lesion in the brain, commonly known as tumors, might present as dementia, and you might treat it just as dementia without investigation, but then if you do an imaging, you are able to identify.
You can locate the tumor and see if it's cancerous or not on time. You know, if it's diagnosed on time, it can save a life. That's a very important point you raised. I'm personally, though I sell allopathy, I'm personally a very big believer and take a lot of alternate medicine, whether it's homeopathy or Ayurveda. And you were talking about growing Brahmi in your home in Mangalore, like a true Shetty. So can you tell us more about your views on the alternate medicines for Alzheimer's in particular?
My mother used to say always that Brahmi should be given to everybody right from childhood.
Okay.
Because the belief we all have as a Indian or as a Bharatiya is that all our saints, when they had to learn the shlokas, they would take Brahmi so that they remember it much better. And I take Brahmi and Ashwagandha for a very, very long time.
At what age should one start taking?
I would say from childhood, actually.
Oh, really?
Actually from childhood, because
this is natural herbs, it's not doing any harm.
This is an era, Namita ji, where indigenous medicines will be rediscovered, and their properties and their effects and their impact would be researched, and we will have a flood of indigenous medicines that are very useful. But at the same time, obey the doctor's advice and don't become a self-proclaimed doctor or an Ayurvedic practitioner.
A carer's role is extremely important. When a man has dementia, because in our country most of the women are homemakers, there's somebody there to take care of the man and be that caregiver. But when a woman has dementia, a lot of men still have to, they may be working, they may still have to go to office, and they may not have the resources to have another caregiver who full-time engages the woman patient. What do you see in such cases, and what is the best plan of action?
Families believe that they should not get a caretaker from outside, because the caretaker will not take care of their mother or their grandmother as much as they would.
But are they available and are they trained?
So that is one mistake which they make. The second mistake which they make is they feel very guilty to allow anybody to take care of their own mother or own grandmother. And the daughters generally fill the gap, not the sons, because sons have to work. And the third mistake which they make is they have unrealistic expectations. Tomorrow there will be a miracle and something new will happen. So to break all this, the state should provide low-cost trained carers for people who are elderly, as they provide free treatment in government hospitals, free IRBs, free nurses. The state should take the issue of the elderly very seriously. Number two, we do not have trained caretakers, and if there's excessive work to be done, he will talk about it. They just run away, or they don't come, or they don't bother. Number three is that community living is one of the most important innovations which can happen in caretaker. So we have a dementia care center, just like we have a gynecologist OPD or ward, or a ward for physically ill. We need to have a group, a team taking care of many patients, where the families share the burden. At the same time, we need to give respite care for the family. Respite care is an important activity where the family is tired of taking care of their mothers or grandmothers for a long time, and then there's some place where they can keep them for a month, and these people can actually live their life so that they are replenished and recharged and come back. So these are the innovations. State should take responsibility. State can't abdicate the responsibility of health and education to anybody else. Burnout is one of the most common complications where the carer gets depressed, carer gets frustrated, carer also gets very suicidal, and carer can lose their physical health, whereby if something happens to the carer, the patient suffers all their life.
Absolutely. And I'm so happy that you got a wonderful young carer for us. Bhavesh, how old are you?
I'm 26. Yes.
26,
Yeah.
and you're a carer. I do want to hear about your story.
So actually, ma'am, I'll start with when my father have diagnosed with this dementia. He used to stammer a lot while speaking. So my sister is psychiatrist, and she was like, he's going through some disease, maybe dementia. She just suggested us that we should have check. And that time, I clearly remember that me and my mother was really opposed that thing, because we are like, why we have to check this particular thing? Like, he's not a patient. The lockdown is going on outside, and if he goes outside, he will talk with his friends, he'll be fine. So that was our perception.
Correct.
That time. So then lockdown just passed away, and we came to Mumbai, and we have those checkup, the brain scan and all these things. And that time, doctors came to the conclusion. They said that he is having frontotemporal dementia. So
It's a difficult dementia.
yeah,
Why is that difficult?
They go down much faster.
Depending on the lobe.
This dementia, they really deteriorate much faster.
What is it called?
Frontotemporal.
What does that
Frontal
mean?
lobe and
Frontal
temporal
lobe.
lobe.
And temporal lobe. So that if that's diagnosed with a scan, you know it's going to be a fast deterioration.
Unlike dementia, which affects the entire brain.
So we were shocked at that time. Like, doctor is saying, and I was still that time also, I was not in that acceptance mood that he is having some disease or something like that. So I remember at the time he used to talk 3 to 4 sentences. Then these sentences came to words. Then this word came to some other word which he can only pronounce. Like, the word was pare. So whatever we used to ask him, like, have you done your dinner? Pare. That's it. So, and after that, now at this point of time, he do not have any, he have lost
The
his
speech
He
area is
stopped,
affected.
speaking completely.
Yeah, the speech area here was affected in his father's case, the speech area.
So your father doesn't speak at all.
No, at this point of time, he don't speak anything.
And
So,
But does he, if he's not speaking, do you know, he's completely forgotten the entire family?
no.
He knows
remembers us.
everything.
Yeah.
He smiles.
Does he write and communicate
No,
with
nothing, ma'am. Actually, all these things are drastically decrease
So
in
the
the period of
speech
time.
and the cognitive ability to write.
slowly
So
go
there is zero communication.
Zero communication. We have seen him a lot. We know his each and every activities. Like, if he just turn, I know what he wants to
he
communicate.
has been a great speaker, a great anchor, and a person who would always live with others. And this is completely opposite of what he was.
Yes, my father.
And at the
actually.
age of 63. Oh my God.
Means, it was quite difficult, but now you can see from my expression. Previously, I used to cry a lot to my friends. I used to say them
Because when this happened, you were 23. It's not easy.
So
you're 26 now, it happened 3 years back. You're not prepared and no one prepares you for this.
Yeah. So actually, it was very difficult for my mother.
So how many hours a day do you spend taking care of
Ma'am, actually, from the morning, he wakes up at 7:30. So from 7:30 to 1 to 2 hours, I have to take care of him, everything, bath, right from bath, toilet, and everything. Then
He's not able to do the basic activities on his
no,
own?
nothing. He forgot everything. Everybody is you are having this situation, dementia, and how you are dealing with it. But I guess I'm spending a great time with my father. I know his each and every activities. He's my best buddy. There are some times when I feel really depressed and really everything is
What do you do when you're that depressed? How do you recharge?
I like coding a lot. I just write the codes and see it's the output and show to my father also. Papa, I have done this. Like
Knowing
while,
fully well that he has no clue what you're talking about.
yeah, means he just smiled, and I that's the my reward.
He has reframed his life. And to do that at this age is
Unbelievable.
My sisters have told me, like, whenever you feel like this, you just called us that I need a break. Then we'll come home, we'll stay with them, and you just go with your friends or colleagues if you want to chill out or something.
Coming back to the cure part, you said it cannot be cured, but you said it can be arrested.
Alzheimer's, some patients' disease get delayed and get arrested, probably because of medications, or probably because some patients might find that their illness is arrested or delayed, probably because of medications, or probably because of the nature of dementia in their system.
So it really depends. There's no stereotypical.
Difficult to predict whose symptoms can get arrested or stopped, or whose symptoms may be delayed and deterioration can be slow. Very difficult to judge in any patient.
Is there anything else we should keep in mind that could help an Alzheimer's patient?
I ask every family to see to it that if your patient can walk, they can walk on the grass, they can interact with nature, they can watch the sunset if they're lucky, or the sunrise, and they could feel the breeze on the beach or on a veranda. And this is extremely important for them to feel better. At the same time, I tell their sons or their daughters, even if they are unconscious, to share their daily activities with their father or their mother, and that keeps the brain very stimulated. And warmth, compassion, and expressed love is very important.
My mother-in-law plays a lot of Sudoku. And she keeps saying it keeps my mind sharp.
Absolutely.
So what are some of these games also that you can play to just keep your mind alert?
Absolutely.
Sudoku is one. What else?
Yes. There's something known as brain gym. And in brain gym, you can use the wrong hands to get your shirt out. You can use the wrong hand to brush your teeth. You can walk forwards, backwards. You can do puzzles, etc., etc. So there's an entire host of activities which keeps your brain active.
Also learning a new skill. They learn a new language.
Absolutely. But there's no evidence to say that it can prevent Alzheimer's. But for normal people, these are great activities to really stimulate different parts of the brain and keep them very active. At the same time, IQ may be really fixed at some point of time, and though neurogenesis take place, focus on emotional intelligence and your compassion so that you can take care of your family members beautifully, and it becomes a journey, it becomes an experience, it becomes a way of life. It also opens your heart to the world around.
But what's really sad about this disease as we wrap up this show is that I'll go back to what the doctor said at the very beginning, that in a country like ours, where the doctor to patient ratio, the nurse to patient ratio, the hospital bed to patient ratio, the counselor to patient ratio, everything is so poor compared to the developed countries. In that, add one more ratio, caretaker to a patient ratio. What is really important in this condition is to have the right caretakers, because not everybody can have a bhavesh who will put his life on hold for the patient. Where do we find caretakers? How do we find trained caretakers? How do we find those who are reliable and will stick around in spite of the challenges is a very big issue. How do we make sure there are these respite centers so the family gets recharged? How do we make sure there's support groups so that the carers who are family members find the strength when they get depressed? There are so many ancillary issues in addition to just treating the patient with medication. And this is where you realize that the healthcare system is something that needs a very holistic approach, that needs a lot of intervention in different aspects. And, we've just touched the surface. We've just skimmed this very important topic. Thank you, Dr. Harish, for being a very important spokesperson. I know you talk a lot about this. Thank you so much, Doctor. Thank you, Bhavesh.
ढूंढने है वो निकली तकदीर अपनी उजली, इल्ली ने मन में ठाना है बन के